Hello students, welcome back to my channel. In this video, we will learn about fetal skull. So, the first areas of the skull we have to know about the vertex, brow and the face. So, the vertex part, it is a quadrangular area bounded anteriorly by the bregma and coronal sutures, behind by the lambda. This is lambda and lambdoid sutures, and laterally by the line passing through the parietal eminence. So this total area is called the vertex. Next, the brow. The brow area is bounded by on one side by the anterior fontanelle and to the opposite side the root of the nose, and towards the anterior fontanelle the two coronal sutures, and towards the root of the nose the supraorbital ridges of either side. This total area is called the brow. Next, the area is the face. This area is bounded on one side by the root of the nose and the supraorbital ridges, and on the other side by the junction of the floor of mouth with neck. This area is the junction between the floor of mouth and the neck. This total area is called the face. Now we will know about the sutures. So the first suture is the sagittal suture or longitudinal suture. This suture lies between the two parietal bones. These are the two parietal bones and it lies between it. Then the suture is coronal suture. It runs between the parietal and the frontal bone. This is the parietal bone and this is the frontal bone, and there are two coronal sutures. Next, the suture is the frontal suture. This suture lies between two frontal bones. Next, the suture is the lambdoid suture. This suture separates the occipital bone. This is the lambdoid suture, and it separates the occipital bone and the two parietal bones. So now we will know about the fontanelles. So of the many fontanelles, two are of obstetric significance. The first one is the anterior fontanelle or bregma, and the posterior fontanelle or lambda. This is the anterior fontanelle and this is the posterior fontanelle or lambda. So the anterior fontanelle is formed by joining of the four sutures in the midplane. You can see that the anterior fontanelle is like a diamond shaped fontanelle. So the anterior fontanelle is formed by four sutures: the sagittal suture and the frontal suture that lies between two frontal bones, and the two coronal sutures, and it shapes like a diamond. Okay. Next, the floor is formed by a membrane and it becomes ossified 18 months after birth. So if it doesn't ossify after 24 months after birth, it can be a pathological cause or some abnormality. Next is the posterior fontanelle, and it is formed by junction of three suture lines, that is the sagittal sutures anteriorly and lambdoid suture on either side. It is triangular in shape and measures about 1.2 cm. Its floor is membranous but becomes ossified or at turn. There is another fontanelle, that is the sagittal fontanelle. It is inconsistent in its present, but when it present, it is situated on the sagittal suture at the junction of anterior 2/3 and the posterior 1/3. It has no clinical significance. So today we learned about the important areas of skull, that is the vertex, brow and the face, and the sutures, the sagittal, the coronal, frontal and the lambdoid sutures. Also learned about the fontanelles, that are the anterior fontanelle and the posterior fontanelle. So this is up to my topic for today. The next day we will learn diameters of fetal skull. Thank you so much for watching. If you like my videos, please subscribe the channel.